More than 7.5 million COVID-19 cases have been reported since India's second wave began 2 months ago. But medical experts believe the real number could be up to 10 times more. Ishan Garg reports.
Crematoriums are running out of space, and incinerators incapable of keeping up are melting down as deaths continue to mount all across the country. The government says for the size of its population, India is faring better than many countries. The United Kingdom, a country with a population of 66 million as compared to India's 1.3 billion, has reported almost half the number of deaths as India. But experts say India's official death figures could only be 1/10 of the real COVID fatalities in the country. And its overall death toll could be close to 2 million, the highest in the world. They are worried that inaccurate data is botching India's pandemic response.
Poor quality data doesn't help anyone. It doesn't help policymakers. It doesn't help the general public. In fact, it could also lead to a breakdown of trust in the system because there is a clear discrepancy between what is seen on the ground versus what is being reported.
Doctors say COVID deaths occurring outside medical facilities are not being counted. Neither are those who've never tested positive for the virus despite having it. To make matters worse, millions in the country do not have a testing facility close by, especially in rural areas. That makes underreporting of cases the root cause of underreporting of deaths. There are also concerns that the doubly mutated strain first discovered in India is not showing up on test reports, necessitating more advanced testing for suspected COVID patients.
And if they want to actually report it correctly, they should also start, taking in account of the CT scan of the patient.
Lung infections due to COVID can show up on CT scans, even though the popularly used RT-PCR tests may miss it. Experts estimate that India is already seeing more than 1 million new infections every day in reality. However, most of them are not reflected in the official numbers, and things could get worse from here. Analysts are saying that cases could peak in mid-May with at least 3 times as many infections being reported in a single day. This could wreak havoc on India's already stretched healthcare system. Now, international support and help has started pouring in, but experts say that it could only be a drop in the bucket. Ishan Garg, CNA, New Delhi.